Welcome to the Perry Health Pulse podcast, a program dedicated to taking you behind the scenes of healthcare, sharing firsthand knowledge from healthcare professionals, and putting you in the driver's seat on your journey to lifelong health and wellness. Listen and learn about how healthcare delivery is changing on our weekly podcast.
Today we're tackling Medicare wellness. Medicare is just a huge beast, but we're going to focus specifically on Medicare wellness visits, what they entail, what the process is there. And today we've got our nurse practitioner, Trudy Argubright. She's been a practitioner for 23 years and is in our Perry Memorial Family Health Clinic, and we're excited to have her. Thanks, Trudy.
Hi, it's very nice to be here.
All right, so I'm quite a ways away from Medicare, but I hear about things for it. So going through the process, what's the first thing that happens when you turn 65 and you schedule your appointment?
During your first year of Medicare, you are allowed a Welcome to Medicare visit. It can be done by contacting your provider's office. Many of the offices have special registered nurses that do these Welcome to Medicare visits. They are done because Medicare many years ago did not do anything preventative. And we all like to be healthy and we like to maintain our health, we would like to know what we need to do to maintain the health. So in your first year of Medicare, we can do a visit where we can do an EKG, especially if you've never had an EKG before. That will look for any cardiac problems. If you have been a smoker, they allow us to look for an aortic aneurysm, which is something that smokers are at higher risk for. If you are a smoker and have smoked for a long enough period of time, they allow us to do a low-dose CAT scan of your chest to look for anything that might be growing in your lungs. Obviously, they're really looking more for cancer or precancerous changes. A chest x-ray is not good at picking those things up. During the Welcome to Medicare, the nurses will look at what immunizations you've had, and they will counsel you on which ones you need. Medicare pays for some immunizations, such as your pneumonia 23, which is called a pneumovax, your pneumonia 13, which is called a Prevnar, and your influenza vaccines. Medicare will only pay for a tetanus shot, which is usually a tetanus, diphtheria, and acellular pertussis immunization if you have an abrasion or a laceration or a cut. So that's one that we can't necessarily do at a Welcome to Medicare visit or a Medicare visit, but that is something that you're supposed to get every 10 years. Medicare does not pay for the shingles vaccine. It is done through a Medicare D program, which is your program that pays for medications at the pharmacy, and shingles vaccine should be gotten through the pharmacy with most plans. It is a vaccine that you have to check with either your local pharmacy or with your insurance to see where you can get that vaccine.
So it sounds kind of like that first meeting is just getting a baseline of where your health is. For some people, they might not have been to see their provider for a few years, which obviously we hope that they go every year, but some might not have been for a while. So it's like getting a baseline of what problems might be starting or might exist already. And
so that is the whole point of doing the visit, is to identify problems that or situations that may become more of a problem in the future.
Now, if that doesn't happen in the first year, is there any penalty for that? Do they just lose the opportunity for that visit?
They lose the opportunity for that particular visit. And again, it's mainly the EKG, and then if they needed a low-dose CT or the aneurysm looked for.
So are those things that aren't covered in a normal Medicare wellness visit?
So in the subsequent years, or after they've been in Medicare more than 1 year, then no, it would not be a covered service.
Okay, so
they could still have them done, but it would be subject to their deductible and any copays.
Okay, so it's a nice benefit to be able to have those done for free. Schedule that first visit in the first year to get those done.
Yes, and also think of the fact that you're 65, and the likelihood of you living at least another 20 years is very practical. And so that the healthier you can be and identify at 65 when you're retiring, and hopefully you have more time to walk and eat correctly and that type of thing. So it really does make a big impact on your future health.
So let's talk after that first appointment where you've got routine checkups. What all does Medicare cover in terms of routine checkups?
Each year, you're allowed to have a subsequent Medicare wellness visit. It goes very much like the first year, other than some of the things are not paid for. But the nurses look to see if you've had immunizations, if you've had, they update your medical record as far as what medications you're on, what kind of surgeries you've had, what procedures you've had, and keeping you just abreast of all the healthy things that you should be doing, like colonoscopies and blood work and that type of thing. Anything that the nurse would order at that particular visit, if they're helping out the provider, as far as blood work and colonoscopies, mammograms, those are all subject to deductibles and they're all subject to copays. So they help to set up what medications and what procedures should be done, but Medicare doesn't pay for those at 100%. Most people's deductibles are $250, and then they have copays sometimes.
So, and there's a lot of confusion I've heard about that at times, where someone will come in for a Medicare wellness visit and have those extra things done or ordered and think that it's all covered. So the visit itself is really just kind of a checkup and see what should we do going forward, right?
Correct. And the doctor or provider would in the future go ahead and order those labs and go over them. So it's a cost that eventually they will have during the course of the year, but it might not be associated with them having come in and seen the nurse.
Now, if they were to come in with maybe a medication issue or a broken bone or something like that to see you, would that be covered during a Medicare wellness visit?
No, the Medicare wellness visit is only with the registered nurse, and it's only for Medicare wellness. So if they have another issue that they have a broken bone or they're having some kind of pain, then that would need to be done at a different visit. And they would need to just call their provider and say, I'm having pain in my right arm, when can I be seen for that?
But then still, of course, if you have a meeting that is more of a physical like that or requiring treatment, it's probably still a good idea to have a Medicare wellness visit at some point during the year still, not just rely on that as your appointment, right?
I think it's very important to have a Medicare wellness, because at your visit when you come in and tell me that your shoulder hurts, I'm not asking about your heart, I'm not asking about your bowels, I'm not asking about other aspects of your health. I'm just focusing on whatever you've come in to talk to me about. And even though I may look at your high blood pressure, I'm not going to necessarily do blood work that might identify that you're diabetic. So the Medicare wellness, to me, does a great job of looking at all your health things. Lots of times I'll have people that are being seen by me quite often because they are ill, and so they're not healthy, but then I don't look at other aspects of their health. So that's why I like the Medicare wellness visits.
Mm-hmm. So it seems like routine visits like this, you mentioned that it's kind of a new thing to Medicare, that they're pushing a lot of preventative visits. Even other insurance have a lot more preventative aspects to it. Why is that becoming such a big push?
Because we know that in order to be healthy 20 years from now, we need to be worrying about it now. In younger ages, we could go for an annual physical and have a head-to-toe physical and talk about all the type of medical problems that we have or might consider we might have in the future. But at Medicare, we just typically reacted. So the fact that we're all trying to be healthy as far as walking more and eating better, that's why we want to do the Medicare wellnesses. The Medicare is pushing for us to do it. They're pushing the insurance companies to make sure that they're being done. And so, but it is a very positive thing for an adult to do.
A lot of adults kind of fear going to see their provider because they think, well, something bad's going to come out of it, and then I'm going to have to do all these things. But that's better than finding it when it's really far progressed down the line, and then it's very serious treatments, right? And
it is. And having been a cancer survivor, when you first get told that you have cancer, you just want it out of there, but you also want to find it as quickly as you can and get rid of it or have it taken care of so that you don't have to have the problem in the future.
Let's pause for just a moment to hear a message from today's sponsor.
3D mammography from Perry Memorial Hospital reveals the results, layer by layer. Early detection, accurate results. Unmask the hidden with 3D mammography from Perry Memorial Hospital. To schedule your appointment, call 815-876-2050. We care, we listen, we are Perry. With clinics in Henry, Walnut, and Prompt Care in Princeton.
So during a Medicare wellness visit, what are some of the common problems that you might be able to uncover or start suspecting at that time?
Lots of times we'll find out people have sleeping problems that they weren't really aware of or they thought everyone had. Sometimes it can be problems related to urination and that they get up 4 times during the night. Well, getting up 4 times a night to go to the bathroom is not a normal thing. And even though they always thought it was a normal thing, it may be something that they don't discuss with other people. Sometimes people will have problems with their bowels. Sometimes they'll have heart problems that they think that, well, I think everybody has this, so then I don't want to talk to anybody about. Sometimes it's memory, and so they don't want to tell someone that they think that they might be having problems with their memory. But this is a good thing to do and talk about and identify, because I can tell you that other people have the same issue, or that maybe it's something we need to look into, and maybe it's one of your medicines or something that can be changed so that you don't have to worry about it so much.
Now, to a certain extent, you've already answered this, but are there any questions or concerns that you really wish patients would bring up to you that a lot of times they're hesitant to do so?
And I would like them to feel free to talk about anything that they need to talk about. That's what we're doing here. We want to make them as healthy as possible. We talk about all things all the time, so it's not like we're embarrassed by anything. I think that bladder and bowels are an important thing that people don't like to talk about. I think intimacy sometimes can be an issue that people don't want to share or talk about, but please know that we talk about those all the time and we're very comfortable talking about them.
Now, in terms of Perry specifically, I know it's kind of structured a certain way. Can you describe a little bit about what the process here at Perry is for patients needing Medicare wellness visits?
So we are very blessed to have 4 wonderful Medicare wellness nurses. We have Beth, we have Cindy, we have Jordan, and we also have Robin. They have been well trained and they work together and continue to educate themselves about the process and being able to help patients. They're all very sympathetic and empathetic, but they take time and they are allowed to take the time to talk with the patient and find out that what their concerns are. You call and you make an appointment. Please call and make an appointment saying that I'd like a Medicare wellness, and then they'll connect you with one of those nurses. If they happen to be busy with something else, they'll take your phone number and they'll give you a call back. They like to completely explain what the process is and say that their actual visit with them is free of charge, which it is. They will let you know if they end up ordering some blood work that your provider would like you to have, that is subject to deductible and co-pays. You make an appointment and you come in and see them. Typically, they see people at 8 o'clock in the morning, 10 o'clock in the morning, and 1 in the afternoon. They allow a whole hour for your visit. If it doesn't take that long, then they're very happy to let you go sooner than that. But then they have a series of questions which Medicare has asked them to ask and things that they've asked them to assess as far as if you're steady on your feet, if you have any problems with falls. They ask about smoking history. So they go through a process that's already been delineated, and then you can follow up with your provider after that if that's how we set it up.
That follow-up with your provider is still a pretty important aspect of the process, right?
I like to set up my Medicares where then somewhere between 2 and 4 weeks afterwards, then I'm following up with the patient. I like to have my Medicare wellnesses, I like to have them order the blood work so then I can go over the blood work with the patient sitting in front of me and we can discuss what it is, what it means. And then also then if they would like to take a copy home with them, I can have them sign and they can take a copy home so that if their loved ones want to know what their blood work was, then they can go over that. At some point during the year, the provider has to see the patient, so that they would have to follow up for their medication anyway. And so it can be done right after that. And then some people need to follow up more often. And so it depends on medical history and other needs, how often they have to follow up.
And just to be clear about that too, any follow-ups after that visit are going to be subject to deductibles, right? So
they
just so
are.
that, again, it's not all part of the same free visit.
So there are many people that have different kinds of programs for Medicare. So if you have the red, white, and blue card, then you are entitled to a Medicare wellness visit. If you have an Advantage program, if you have a different program, you need to check with your insurance to see if they allow you to have a Medicare wellness visit. Some people are allowed to have an annual physical visit. Those are things that we don't know from our end. So if you don't use the red, white, and blue card, then please give your insurance a call and ask them if a Medicare wellness is covered. That helps us out and it also helps you out.
Well, yeah, and in general, we definitely recommend checking with insurance before any appointments or anything that you schedule with the hospital.
And I would like to say that we try to navigate both insurances and Medicare. Please know that from our aspect, we know it's a hard thing. And so we do ask, if we ask you to call, we know that you'll probably be on the line at least an hour, and I apologize for that ahead of time. But there's lots of times that they won't tell us things that they will tell you. Thank you for considering doing your Medicare wellness visit.
Oh, and thank you, Trudy. It doesn't stop here. Access other podcast episodes and resources related to today's episode by visiting www.perrymemorial.org/podcast.